We'd like to welcome you back to part 3 of our health corner for October 17th, 2017. And again, this is a review of the really a lot of different health issues and clinical nutritional supplements you can use, and other things I can think of off the top of my head to battle given conditions naturally. And um, uh, we're looking at also alternatives to the standard process product line that I've brought in. So let's continue further. We're at cod liver oil by Standard Process. Again, I told you about the Farmex fish oil that I brought in. Again, that's all they do. Basically, that's their main baby that they specialize in, and I don't know anybody that's really doing it better than them regarding purity and just value for the money. So I would I would highly recommend that one over the Standard Process cod liver oil. I do also have the gummy for the kids, the Nature's omega-3 gummy, but again, I'm not 100% sure how long I'm going to have those because Nature's Dynamics has been off the radar for about 4 months now, I think, and I ordered as much as I could when I found this out, but my stocks are kind of starting to dwindle down on that. I will probably bring in a Farmex fish oil, like a chewable for kids, when I run out. I think I've got 2 or 3 more bottles left, because I'm sure they have one for children. I just don't like switching product lines constantly because it's obviously confusing to my customer base. But here's an example where I just don't have a choice at all. I mean, if the company goes off the radar, then there's not a whole lot I can do. Next product, Collinsonia root. Already talked about that for the hemorrhoids. It's a tones and strengthens the veins. I don't know anything better for hemorrhoids than this. But again, hemorrhoids, you got to look at the liver as the actual root cause of creating the back pressure, creating the hemorrhoid in the first place in varicose veins. So we already covered that. I brought in a product, Genestria Collinsonia Formula, 90 capsules for $24. Next product from Standard Process, Conjuplex. Was a product for acute bacterial infections, a short-term acute product. Like if you felt a cold coming on, it was a good one to take. The one I've brought in, I believe, is more broad spectrum, covers more bases. From Biotics, it's Bio Immunozyme Forte. It comes in a 90 count and a 180 count. The 90 count's $35 and the 180 count $66. It's, I just feel it's a better overall product blend, covers more bases, and a really good one to have on hand if you feel a cold coming on and you're not just wanting to rely on the silver. The silver is really expensive, especially the 5,000. I mean, I'd be the first to admit it. I'm not the one that designs the price on it, but it is an incredible value compared to going to a health food store and getting a 20 part per million. You can get a 5,000 part per million that has a shelf life of we don't even know what the shelf life is. There's never been a bottle that's went bad if kept. The only thing I think they said that can degrade it is sunlight, and that's if you take it out of the bottle and put it in like a clear glass container. It already comes in an opaque container, so it's kind of shielded there. But you wouldn't want to expose it to direct sunlight if you could avoid that. Even the opaque container, the shelf life is unbelievable. It may be 100 years. They don't know. They've never had one go bad. It's extremely stable. It's the most stable silver on the market, colloidal silver. And that's the one I carry. And you can also get it, if you're overseas, you can get it at my website. Or even in the States, you can get it at my website. It's actually in Vive's website. They put the website up for me. It's Dr. the dash symbol, Johnson.com. And you can get it up there. But if you get it from me personally, you'll get it at a better price. This is a good one to keep on hand for colds and flus and that type of thing. If I could probably have 3 things on hand for like the cold, the flu season, that type of thing, it would be this product, Bioimmunozyme Forte, the C400 by Innate, the Whole Foods C, and then the silver, the 5,000 part silver. That would be a good collection of things to have. And then the next product by Standard Process, copper liver chelate. It's their dedicated copper product. Not a lot of times that you're going to use this. I rarely ever prescribe it because I'm not big on prescribing any one particular trace mineral, because if you just take that one trace mineral by itself, you're going to create imbalances elsewhere. For instance, copper competes with iron and zinc in the body. So, like the one product I talked about, Keysin, that was for the skin, that was a balanced iron, copper, zinc, and also had B12 in it product. So you're not going to create any real deficiencies with other trace minerals in the body. In other words, when you take a mega dosage of any one thing into your body, the body has to throw other trace minerals and other nutrients at that in order to process it. That's why it's always good to start as your base product with a good whole food multi, because you're covering a lot of bases. You're going to fill in a lot of gaps with that. The copper is really important for collagen integrity, skin. There's an immune system application for it. But generally speaking, I'm not going to be prescribing copper by itself unless there's a real specific reason to do that. Now, something like iron, that a woman in particular is losing every month, that's something that you could take a dedicated, because she's losing it anyway, because she's losing it through her cycles. The blood, which carries the iron, she's going to be losing it that way. So that's something where she needs to hypercompensate, whereas a man doesn't have that problem to the extent. Now, not to say that men can't get deficient in iron. If anybody is working out a lot, they're doing a lot of aerobics, you're going to burn up iron. You are going to burn it up. I mean, it's like integral with hemoglobin and red blood cells, and you're going to burn a lot of that up with exercise and activity, which you should be doing anyway. So the only way to really know about a lot of these is, blood tests. Hair analysis can be good, these types of things, but you can research that online. Next product, Saruta Plus, we already talked about it. That's the one that I would typically prescribe for the gums. Believe we use Saruta Plus when there wasn't gum infection. We use Cataplex ACP when there was gum infection, like gum issues with a gum infection. But the product that I brought in, the Bio FCTS by Biotics, it's a product that covers both bases. You can use it with or without infection. It's my bioflavonoid go-to product now. So I'm killing two birds with one stone there. I can eliminate a product from my product line, essentially, or two from my product line, and just carry the one. So it makes it easier. It makes it easier for the customers too, because it's like, it's not as complicated anymore. Okay, so we have that. Then the next one is Cruciferous Complete. Typically, you would use Cruciferous Complete in a macular degeneration case. Macular degeneration of the eyes, which is typically where you get degradation of the macula, essentially, and it's specifically linked to low antioxidant levels. Xanthine and zeaxanthine, I believe, are the two. Well, the Cruciferous Complete, they're Brussels sprouts and kale are very, very high in those antioxidants. Okay, and that's why I would prescribe that one typically. The one I have now that's actually a much better value is the Innate Response Renewal Greens. It's a whole bunch of different green products in a powder form, and it's kind of like you could probably use it as as an alternative for any kind of multivitamin regime that you're doing. And it has I don't know how many different green products in one powder form. Very, very good value. You're getting a lot in one product. It's pricier. It's $53 but it's a pretty decent. It's a 300-gram canister. So that's another thing. Some people don't want let's say they don't want a pill multivitamin. They don't want a liquid. They want like a powder. Well, this would be a good alternative as a green product. And the green products, the thing about the green products too is they typically have a lot of attributes of chelating heavy metals out of the body. They're rich in B vitamins. They're very, very rich in chlorophyll. That's why they're green. Okay, the blood of the plant, the chlorophyll. They're very healing internally. They're very, very good for the detoxification pathways of the liver, the cytochrome P450 phase 1 and phase 2 enzyme pathways. The green products like kale and those types of things have a lot of those phytonutrients and methyl donors and the things that occur in like cruciferous vegetables that have a lot to do with liver detoxification. So it's an ongoing type of product you could take and it would cover a lot of bases. And that's the Renewal Greens. That's a product I haven't said a lot about, but it's really, really good. And I mean, if you compare it to Cruciferous Complete, there's really not a comparison. It's just a way better. You're getting way more. Next product, Dermatrophin. PMG from Standard Process. It's, as the name says, derma, meaning skin. That was my kind of my product just for any skin case support. What I've brought in to replace that is the it's called Hair, Skin, and Nails Plus formula. It's just a basic general formula for building up hair, skin, and nails. Okay, let me just look at that one real quick. Because I'm seeing if this one has silica in it. It's got manganese, zinc. Zinc's really important for the skin. Calcium, vitamin A is very important for the skin. Bioflavonoids, PABA, horsetail. Okay, it does have horsetail. Horsetail would be the silica. And the silica would be super important. Lecithin. So it's kind of an all-in-one product for skin. Plus, it does have the silica in there. So that would be the one I do for hair, skin, nails. Now I would do the dedicated silica that I have for any kind of bone or teeth case. Or you could take it as an adjunct in any hair, skin, and nail case. You could actually take it even with this one. I've got Taylor on the silica now, and her hair's growing like crazy from it, and her nails and everything from it. So that's a really, really good protocol as well. Okay, let's go further. Drenamin. Drenamin was the overall, like, kind of your catch-all product for any adrenal case. Okay. So and again, it was tablet form. The tablets tended to oxidize. Some people did real good on it. Some people not so much. The one I brought in, or the two I've got right now, are Adrenomend, which is a really good overall adrenal supplement. Probably the best one I've ever actually had on my line. Just covers a ton of bases for the adrenal glands. And then also Cytozyme AD, which is the specific glandular to rebuild the adrenals. If you had a really bad adrenal case, you'd want to do both, because the Adrenomend doesn't have the glandular component like the Cytozyme AD. But the Cytozyme AD doesn't have all the other components all the other phytonutrient components that the adrenals need. So those are my two there. The Adrenomend, and all the prices are here listed too. So you can even follow along with this. You can literally print this out if you wanted to, and follow along with what I'm doing right now. The thing about it is it will be in the PDF format connected with this teaching. This is probably going to at least be a 4-part teaching, but the links are clickable. And they should all be good links, meaning they're going to take you right to the website where this is talked about more in depth if you want to know more about the particular product. You won't be able to actually buy them at the website because they're professional lines that we're using, but it'll take you to the professional sites that'll give you the description of everything. Okay, so let's go further here. E-manganese from Standard Process, which was primarily a pituitary supplement. You would do it in very specific cases of pituitary issues. And you typically would do it along with pituitrophin. So the one I'm using now for that is and I've mentioned it before, is the Cytozyme PT HPT, which stands for pituitary hypothalamus. It's more of a all-in-one pituitary hypothalamus supplement. I think it makes more sense, because if you're going to treat the pituitary, you probably should treat the hypothalamus because they're very interconnected and there's a lot of interplay between the two. Next product is Enfaplex, which was originally marketed by Standard Process as a supplement for emphysema. And that's why they called it Enfaplex, or for smokers. So it's kind of an all-in-one supplement you could give to a patient that was a smoker that wanted extra lung support. The product that I've brought in to replace that one is called Pneumozyme. And the Pneumozyme, and here is another example of this product is going to replace both Enfaplex and Pneumotrophin by Standard Process. Pneumotrophin was their version of their dedicated glandular for the lungs. Okay, so for a lung case, you would typically want to do, if you were just using the Standard Process, like maybe Enfaplex, add some Pneumotrophin in, and maybe Cataplex A, because you want to have that A component with the and probably some vitamin C as well, because A and C are also important for lungs. Well, here's the cool thing about this product that I love. Not only does it replace Enfaplex and Pneumotrophin, not only is it the glandular for lung healing, support, and repair, but also, guess what? The other active ingredients are vitamin A, natural carotenes and palmate, vitamin A, vitamin C from calcium ascorbate, vitamin E, another important fat-soluble vitamin. You get selenium in here, and then you get the lung tissue concentrate, and then also bioflavonoids, which is integral for your vitamin C complexes to be activated. And then it's also in a natural food base with catalase and superoxide dismutase, and it's in a food base. This is probably the finest lung product for any lung case. Now, it could be, okay, I came down with a cold, it's starting to move into my lungs. Like I said, if you have like this 12-hour window typically where when you feel something coming on, if you really load up on nutrients, if your immune system's halfway decent, a lot of times you can fight it off. You load up on like maybe that Bioimmune Forte and or the C400 and or Invive 5000. But let's say you weren't even near your nutrients during that time. You're already sick. You've already got a full-blown sore throat, and we all know where that will typically head. It'll either move into the sinuses and or move down the throat into the lung fields. One of the things that you can do is if it's already in your system and you kind of feel like it's trying to get into the lung fields, you take this product, and this will help head it off at the pass. If you already waited till it's in your lungs, yes, this would help. But again, the longer you wait, the longer the battle is going to take to actually win it. So the quicker you can jump on any kind of infection, the better. Now, if it's a viral infection, okay, meaning it's not bacterial, meaning it's not so much a sore throat, but you start to feel real achy, and your muscles are achy, and you're just whoa, it's not even in your throat, then that's probably a virus, okay? And in a viral thing, you could still do the silver, and you could still do the vitamin C, but what you would want to do is instead of the, I think it was the bioimmune, I'm still learning the names on all of these things, to be honest. Instead of the immunozyme forte, okay, which would be for primarily bacterial, what you would want to do is actually take something for a virus, okay, so take something to actually combat the virus. Okay, so in that case, the better choice, and I'm not saying you'd have to have this, but a better choice would be the UltraVir X, okay, for any viral case. And that's by Biotics, and 90 count for 29. It's virus specific. Also, I do have the innate response, immune response, which is kind of you could kind of use the innate response, immune response for both. You could kind of use it for the bacterial or viral. It's kind of a catch-all, okay? So it depends how specific you want to be. I don't want to make it too complicated. I'm just saying there are specific tools that let you hone in on specific things more. So again, since I've already mentioned it, the one for the viruses that you would use, like, and this was typically long-term immune system support for viruses, would be Imuplex by Standard Process. And again, probably the most direct crossover I have for that is the Ultravire X by Biotics that I just mentioned. And so we have that. Okay, so we talked about the Pneumozyme, and best product I've ever seen for lungs overall. Then we jump to Ferrofood by Standard Process, which is their iron product. Okay, kind of in a whole food base. I really like, though, the product that, and I've done this for years. I really haven't emphasized Ferrofood for a long time. I've been using the Innate Response Iron Response. It's in a whole food form, and the thing with iron is, and especially with women, it tends to be constipating, and the closer you can get to a whole food form iron, the better. It tends to also upset a lot of, particularly women, when they try to take it, and particularly if they ever try to take it on an empty stomach. It's very hard to break down. You have to have an acidic gut to break it down. You have to have an acidic gut to break down iron, zinc, protein. It's also very, very important to prevent parasite infestations, because if you don't have a acidic gut, which is how God designed your stomach to operate at a pH of 1.5 to 2.5, which is very acidic, can digest nails over time. If you put a nail in that acidity, it would digest nails over time. If you don't have that, then you're very, very prone to parasite infestation, because you have to have an acidic gut to digest parasite carcasses on things like salads and things of that nature that you would be consuming. And if you don't have an acidic enough gut, they can actually get into the intestinal tract, which is more of a neutral pH, and then implant, and then, grow from there. So the Innate Response, let's see here. Okay. The Innate Response, iron response, is like in a whole food form. So it's typically easier to digest, but I always say just take it with food. And the only way I really know of to get probably a therapeutic dose of iron naturally for a woman, they say I don't want to take a pill, I don't want to do that. The only way I really know of to get a therapeutic dose naturally is blackstrap molasses. So that is an alternative. You can go that route, and that's a great route. It's whole food, the whole 9 yards. It's just that a lot of people can't handle doing that every day and the taste and the whole 9 yards. So again, particularly important for women when they're having cycles. Okay, once they hit menopause, not near as much of a deal, because they're not losing that blood every month. And so that's something to bear in mind. Okay, next product, folic acid B12 by Standard Process. That was typically given for short-term memory, hearing loss, certain instances of folate deficiency. It's very, very important to have enough of the folate, particularly when a woman is pregnant, to prevent neural tube defects. Okay, and that's why the Baby and Me whole food multivitamin that I have by Innate, it has a good dose of folate in there. And like, for instance, I don't think my mom took enough of it because I have a partial spina bifida at L5, the fifth lumbar. I don't have spina bifida full blown, but my spina bifida is basically where the spinous process is when they come to ossify. When you're a baby and early as a child, they don't quite grow together. And it just basically, my lower back's always been a little bit more unstable than I would like it to be. I do a lot of heavy lifting, but I'm careful, and I've built up the musculature in my lower back and in my core and in my abdominals to compensate for it, which really is a super, super important thing to do anyway for anybody. To have a really strong core is a really good way to prevent lower back injuries. And I've been in numerous car accidents when I was young and had incredibly time of heavy lifting for a long time, and my lower back's still good. Another thing I've started implementing lately, which I think is good for a lot of people, particularly if, and I'm a chiropractor, okay? I've been a chiropractor since '93. I'm not in practice now, but I just don't have time. The ministry doesn't afford me that, and all the questions I have to answer don't really afford me that. And then just everyday life too. But I don't like going to see a chiropractor when I can avoid it. I haven't seen a chiropractor in years. I adjust myself. I mean, I have my own, what they call SOT blocks. I have my own activator. I mean, I can do stuff on myself. But there's certain things that I started to have a left hip issue, probably from leg pressing too much weight. And I found that I bought an inversion rack. We had one when I was a child growing up. And I have found that is one of the best things you can do to decompress not only the lower back, but also the hips and the ankles, the knees. It just kind of decompresses. It decompresses your spine. Very, very, very good. It's just an excellent overall therapy to do, and that's something that if you're having a lot of chronic issues with your lower back. And I mean, you can go to a chiropractor and they'll do, typically they'll do maybe some type of traction on the lower back, but I doubt it's going to compare to what you're going to get on an inversion rack. And now the inversion racks they have now, like the one I've got, it has like a pin that you can put in where you don't go all the way down. I don't do that. I go all the way down and just hang. But a lot of people, make sure if you get one, evidently it's a pretty common thing to not be able to get back up on your own if you're not used to it. I can do it, but I've had one, like I said, when I was a child, and I used it even back then. But make sure if you get one that the first time you do it, you can get back up. Make sure you have somebody there, because I guess some people can't. And there's various hip stretches and stuff like that you can do on the inversion rack to really stretch the hips out. There's also a lot of other stretches. If you have any problems with any particular body part, a lot of times it's good to just go up to YouTube and key in stretches for that particular thing. Stretches for shoulders, stretches for the hips, lower back, all kind of stuff you can do. That by itself a lot of times will help improve mobility. And then I'll get a little bit, actually we're going to get into that real soon on joint supplements that you can take. But that's something you can do. Also, there's another thing. If you have weak ankles, I found that if you don't want to buy the device that I'm talking about coming up, I kind of bought it because I will buy things to see how they work on me, to see if I'm going to recommend them to my listeners, type of thing. And I've had a lot of issues with weak ankles, and just turning my ankles over and over. And I found that just doing like the one thing of just literally balancing on one leg with just your other foot slightly off the ground, so you're not going to fall over, you can catch yourself. And maybe have something there you can grab. That can really make a big difference in strengthening the ankles. As soon as you go to one foot, you'll notice that your body starts to fire all these muscles in the ankle area and in the foot area in order to kind of keep you standing. Okay? You can do that, I don't know, 30 seconds to a minute each side. That's a really good way to strengthen the ankles. Now, there's a lot of, you could go up there and do 20 minutes of exercises on strengthening the ankles. For most people, it's not practical. I found, as far as bang for the buck, that's a really good one to do. There's also a thing called a sand dune stepper, which is actually come into vogue really in the last year more so. It's been out for a few years. But it's a device, and I bought one, that you kind of can jog on, you can walk on, you can run in place, you can do squats on it, and it simulates kind of that sand dune feeling. It's a specific kind of memory foam that's, you don't bottom out in it. I'm a big guy, I don't bottom out on the thing. It's very, very highly durable, and a lot of people, it's really revamping their lives. They're able to rehab their lower back, their hips, their ankles, their knees. It's almost anybody can do it. They've got Parkinson's and Alzheimer's patients that couldn't even walk that are actually walking now from this thing. They're doing it in a walker, but then they get to the point where they can throw the walker away and actually start walking again. Now, it doesn't take Alzheimer's and Parkinson's away, okay? I do have protocols for that. I'm not even going to get into that today. I don't really have time, but I do have a file I can send out. But it would be amazing to do with the right nutritional program. And I know with any kind of Alzheimer's or Parkinson's things, one of the main things you want to emphasize is a good coconut oil. And really, the oils in general, like that good fish oil and a really, really good organic cold-pressed coconut oil would be a dynamite combo for any Alzheimer, any dementia case, any brain case, because you got to have those good fats. But the training of the proprioception in the body, of that central nervous system in that, and of the musculature, the sand dune stepper is probably the finest thing I've ever seen that you do. You can just key in sand dune stepper on like YouTube or even on the internet, and you'll find the guy. You know, you should find videos up there and all that. So I have nothing to gain by saying this, but I think that could help a lot of people. It's kind of why I wanted to do this, because this is like I'm kind of thinking off the top of my head some of the things I've discovered recently that can make a major impact in people's lives. And a lot of it is combining exercise and lifestyle changes with the clinical nutritional supplementation to really get the most benefit. You're not putting all your eggs in one basket. You know, another thing that you can do, and I was going to talk about this product later, is you can take ribonucleic acid or RNA, and that's the one that Standard Process had a product called RNA, and the RNA will help to charge the cerebellum, which has a lot to do with the balance and that type of stuff. And that's a really, really good one if you find that you're losing your balance and you're just uncoordinated, that type of thing. The product that I've brought in is called Nucleozyme Forte, which is actually, I believe, a superior version of the RNA. It's got the RNA in it, okay? And it comes in a 90-count bottle and it's 30. That's another thing you can do that will help your balance. The sand dune stepper will actually train the muscles and strengthen the ankles and the foot and the knees and the hips and that type of thing. It's a very, very good combination I found with the inversion rack that I'm using now. Okay? And these are things that can make, I mean, I'm sharing with you literally 30, probably going back as far as I would, 30 years of knowledge, and I'm trying to cram it in. I don't even know if I'll get this done in a 4-part teaching, but you're literally getting, like, if I were going to teach other doctors these product lines, because that's what I was kind of being groomed to do before with the Standard Process, but I could do it with this too. This is a very, very similar to what I would be telling them, how to implement this in their practice. And so let's go further here. So I left off on folic acid and folic acid B12. I talked about short-term memory and that. The product that I would use would be, and I've already talked about this, the homocysteine response, folate, B6, and B12. Because if you're going to take folic acid, you really need to do it with B6 and B12. It's one of those things where you really want them all together, okay, to create that balance. Just like, generally speaking, if you didn't have a deficiency, you really would kind of want to do copper, zinc, and iron together overall. So there's certain things you really do want to do that with, and this is another one. Next product, Gastrofiber, which is basically, it's a product I take a lot of. I haven't said a lot about it. If, let's say, you're eating a meal and it doesn't have any fiber. Fiber is always good to have, typically with meals. It just helps the whole intestinal. You have little muscles in your intestine called haustra. They're like ribbon-like muscles. They line the intestinal tract. Fiber actually exercises those muscles. So people that don't get enough fiber in their diet, it's like those muscles, you don't lose it, you don't use it, you lose it, that type of expression. And these types of people can sometimes be very prone to diverticulitis and constipation and these types of things. Now, if I have a constipation case, I always say start off with a good flora product. You know, obviously you want to get your digestive system going good. I mean liver, gallbladder, making sure your enzymes are good. But a good flora product is always the base product I will use in any constipation case. Beyond that, the fiber is very, very important. The thing you have to run into with fiber is that you want to make sure you're taking it with enough water. Now, these are just capsules. It's not like you got to load up on a ton of water, but the ones that I have brought in are the Colon Plus caps. Now, let me just look at these a little bit more so we can go over this product better. Okay, so we've got psyllium as the first ingredient, and then apple pectin, peppermint, flaxseed, anise, bromelain, celery. Oh, it's even got some acidophilus, the DDS-1 strain, which is a very good strain. Boy, that's pretty cool. Aloe vera, which is a lubricant in the intestinal tract. Prune, which is we know about. So you could probably do this Colon Plus caps just by itself as a standalone product. You are getting some flora support in there too. So again, this is a product that could potentially replace like a dedicated flora and a dedicated fiber product and kind of have an all-in-one, plus it even has some enzymes in there. You're covering a lot of bases. That's what I like about this product line. You're covering a lot of bases. It supplies multiple sources of fiber along with enzyme and probiotic constituents to support healthy bowel flora and GI function. It may furnish a smoothing effect and provide bulk, which promotes natural elimination. So this is probably the product I'm going to switch over to when I'm through with my gastrofiber, when I've gotten rid of all the stock that I've got, because I've taken that other one for a long time. So this is, I don't know, this looks superior, again, than anything I've pretty much been using up to this point. I just want to check. I do have that in stock, the Colon Plus caps. So that one, particularly with women, I know I said a lot about women. I don't mean to be prejudiced, but I'm saying over the years I see what like different genders are more prone to, and women tend to be more prone to constipation. And I can't tell you how many patients I've had come in or even heard about from other doctors where it's like a normal thing for them is having one bowel movement a week. And I just can't even possibly comprehend that. I mean, you should be like 2 per day, should be like pretty much the minimum. But, you know, I would say if you had like a bowel case, okay, and that was the primary issue, constipation, you want to start out with a good probiotic, okay, probably the 200, the Flora 200 that I talked about by Innate, because that one, if you've got somebody that's been on antibiotics and that, you really want to establish the good flora. And then it would kind of be a toss-up. I would rather see somebody long-term on the Colon Plus caps that I just talked about, because it's more of a long-term solution. It's got the fiber, it's got enzymes, it's got a lot of the things you need for long-term colon intestinal health. But if you have a really bad case and you have a lot of constipation and it's severe, you might want to just do the product that I have called Super 2. And the reason it's called Super Number 2 is it gives you super number 2s. I mean, it's the most powerful herbal product I have for constipation. And I've rarely ever seen it fail. I mean, it's heavy duty, put it that way. But that would be like in the most extreme case on that. So you kind of have different gradients of things that might be necessary. So okay, we just covered that issue. The other one, the next one is Ginkgo Synergy. Ginkgo Synergy would be like a blend of ginkgo and some different herbs for. Typically, you're going to use this for short-term memory improving. Okay, the folic acid can help with that. Obviously, the ginkgo helps increase blood flow to the brain, like a vasodilator type of effect. And the one that I've brought in is ginkgo. I brought in a more of a therapeutic dose, ginkgo 60 milligram, 60 capsule product, and that one is $26. So that's a really good one for short-term memory. The next one is glucosamine synergy, and that was the one by Standard Process. Now, one of the reasons I didn't push this product that much is because they derive their glucosamine from crab shell source, and I just hate crab shell source. The reason being is crabs are bottom feeders. Shellfish are bottom feeders. And they eat all the garbage that falls to the bottom of the ocean. Feces and all the other garbage that, the way that they're polluting the oceans and stuff like this. Well, a lot of those heavy metals and PCBs and carcinogens get concentrated in the shells. And they use those shells to make glucosamine, and glucosamine sulfite in particular. And I always am looking for clean sources of glucosamine so I can get away from the other. That was why I was so reluctant to. Yeah, it was a good product. It worked good, but it was like, why do they have to derive it from that? Okay, so this is kind of a dual answer, but I would say if I had just two products to use for a joint case. Let's say you came in, they weren't holding their adjustments, they were prone to injury, they had chronic lower back, chronic knee, just chronic joint stuff in general, a lot of inflammation. The two products I would do right now would be it's called Disc Discovery, okay, which is a product that has a lot of different stuff in one pill, essentially. And I'll just go over that real quick. You're getting vitamin C, D3, B6. A lot of these things are really essential for joints. Magnesium. Then you're also getting a therapeutic dose of manganese, which was the main thing I was looking for because I was trying to see what I could use to actually replace Ligaplex 1, Ligaplex 2, and possibly glucosamine synergy. This product is the closest thing I could get to doing all of that, and manganese B12 by Standard Process. This is the only product I could find that was a good joint preparation, that had a therapeutic dose of manganese, and it had some type of joint rebuilding compound. In this particular case, the joint rebuilding compound is bovine tracheal cartilage. So you don't got to worry about it being derived from bottom feeding shellfish, okay, with all the heavy metals and the PCBs and all the garbage that goes along with that. This has a bovine tracheal cartilage, 400 milligrams. It's got a really good dose of it in there, which would be for like a rebuilder for any kind of joint case, cartilage, stuff like that, even discs, okay. And then it also has a horsetail, which is the source of silica, which is really important in any joint case I'm finding. And then also pepsin, taurine, and serine. Taurine and serine, some different amino acids and things of this nature that are good for joints. And for the money, you get 180 tablets of these, and for the money, it's a very, very, very good deal. Let me just find my place where I left off here. $29 for 180 tablets. So if you had a bad joint case that came in or that you've got, I would probably do 6 a day for at least the first month. And you would literally only go through one bottle and cover a lot of bases. I would do probably 2 with meals, take them with food. If you have any digestive issues, and now this is something that will go all the way across the board, you would want to take like 1 hydrozyme with like your meals and or with your pills if you weren't digesting properly, because you could spend $200 a month on nutrients, but if you're not digesting them, what good is it doing you? So the hydrozyme, the 90 count or the 250 count that I'd mentioned before, that would be the acid-based digestive enzyme that is really going to get the job done and have a much longer shelf life than Zypan. And really, it does a better job. I believe Taylor likes them a lot better already because that was a product she tended to need. And I would recommend that. Let's go back to this. Now, the other product that I would do, and I'm actually doing this protocol right now, is it's called Ends Flame, meaning it's ending your inflammation. And it's a powder. And I would say if I could only do 2 products for a joint case now, to keep it as simple as possible, I would do the Disc Discovery and I would do this Ends Flame product. Because it has a lot of different stuff for the joints. I just got a bottle of this off the shelf. I notice a big difference if I don't do this product. Like, I can miss a day, but if I miss like 2 days, I feel it. I start to feel it because, I've beat up my body a lot over the years from all the training I've done. First ingredient is cetomyristoleate, or known as CMO, which is, I would believe, the University of like Bethesda or something, or the medical hospital there did studies, and they found that this can actually cure arthritis. CMO. Now it's not promoted very much. You don't hear a lot about it, but it is an amazing product. It's got 1,000 milligrams of CMO in it, which is one of the things that really caught my eye about this product originally. And then it has a proteolytic enzyme blend of pancreatin, bromelain, papain, pepsin, and protease. These are all they're enzymes that are anti-inflammatory, and they will they're just highly anti-inflammatory, and they also contribute a lot to joint repair. These enzymes that get into your system. It's got a product called DMG, which is really good for the joints, and then it also has the curcumin, which is the active component of turmeric. It's got a curcumin C3 complex, which is more of an active component of just plain turmeric. So you're getting the turmeric in there as well. You're getting, looks like it's yielding 190 milligrams of curcuminoids, which is the active component. Then you're also getting Boswellia serrata. Now that was a dedicated separate product. I still have it in Medizyme. You're getting that. That's another incredible anti-inflammatory herb, Ayurvedic herb. And you're getting 130 milligrams of that. Then you're also getting ginger, the ginger root extract, and again, another really good anti-inflammatory. Quercetin, another very good anti-inflammatory, good bioflavonoid. Rutin, another very good anti-inflammatory bioflavonoid. And then cayenne, which is, they add like 5 milligrams of that just because it tends to supercharge a lot of things. And then it's in a base of stevia. Very, very good taste. It has it's an orange powder taste. It doesn't have any, like, it just says stevia. It doesn't have, like, aspartame or NutraSweet or Splenda or any of those really bad sweeteners. I'm telling you, this stuff is amazing. So, and I'm always trying to simplify protocols, okay? And this switch over to these other product lines, as you can see, I'm able to eliminate certain products. This might be all you would need for even a bad joint case. 1 scoop of that a day of the Ends Flame. At most, probably 2 scoops if you had a really, really bad case, and then 6 a day on the Disc Discovery. The other thing you might want to consider adding in is the fish oils, because the fish oils do act as a joint lubricant as well. I didn't even talk about that before, but that's another thing they do as well. That would be pretty much the full protocol. I would recommend for like just about any joint case. You're going to cover a ton of bases, get the most bang for your buck, and the Ends Flame is $60. It's pricey, but there's a lot of stuff in it, and for 30 servings. And then the Disc Discovery, again, it's 180 tablets for $29. That, I'm telling you, that is a dynamite combo. Next product, Hypothalamus PMG. They had a dedicated product for this before. Again, as I said before, I'm just using now the Cytozyme PT HPT, which is the pituitary hypothalamus glandular combo, which covers both bases. I can eliminate 2 products there. Actually 3, because I'm eliminating E-manganese as well. I love it. My product line has shrunk, and I'm glad. Immuplex, I already talked about that one. The most direct crossover I have is Ultravirex Bibiotics, and this is specifically for any viral case. Okay. And then inositol, by Standard Process. The inositol that I've brought in, I've actually got a powder now too. I don't even have that listed here, but it's a really good value. I think it's like 30 for a container, a huge, big container of inositol. I've also got it in tablet form, 200 tablets for 24. Much better value than the Standard Process one as far as what you're getting, and it's the same inositol that you're getting. Okay, next product, iPlex. iPlex is a product that I never really saw that gigantic of results with. It is a good overall eye supplement that Standard Process made. I really believe the one I'm using now, it's called Healthy Eyes. Overall is a much better, more updated version of eye health, an eye health product. Now, there are other things you can do for eye health that you can find out about. You go up to like YouTube and like key in like bilberry eye drops, honey eye drops have been used for a long time to eliminate, I believe, cataracts. Castor oil eye drops. These are all things that are safe to do. I actually have done all of these and do these. And these are other things you can do from an external standpoint as well as anything you're trying to do internally to preserve your eyesight and eye health. I told you about the MSM eye drops earlier. That's for eye permeability, particularly use that in a gout case. The other eye drop that I do have is a silver eye drop. And I wonder if I might have it might be a combination MSM silver. Anyway, there's two types of silver eye drops. I have one that's more of a benign version, that's more of a low-key version. But if you have an infection in the eyes, like pink eye, the best thing I know of is the 50 part per million in Vive mild silver protein. It's the lowest strength. It's the only time they really prescribe 50 part per million, but it'll knock out any kind of conjunctivitis or pink eye typically in very short order. Like 1 drop in each eye 3 times a day. And, I've never had anybody come back to me and say, it hurt my eyes, and that just doesn't happen. So, unbelievable for eye infections. Okay, just like if you're able to, I've said this before, you get like a little, like the nebulizer, and the kind you can put over your mouth, like with the mask. You nebulize. I've done up to 500 part per million. That's me personally. The Vive says only do 100 part. You can hash that out, but it's very, very good for any kind of lung infection. It's the most direct way I know of to treat a lung infection. If you did that with like the Pneumozyme, Pneumozyme, the one that I said before, if you had a lung infection case and you're doing the nebulization with like the mild silver protein, with 1 drop of eucalyptus oil, and the Pneumozyme, you got like the most dynamite lung protocol I know of. It's amazing. You can also inhale it through the nose and treat your sinuses, or you can go and get the little Afrin spray bottles, dump that stuff out, put in 500 part per million silver, 500, not 100, 500, and then just tip your head back and atomize that into the nasal passages, and it's the best thing I know of to clear out a sinus infection. If you've ever had a sinus infection, you know they can be incredibly painful. I've only had a couple in my life, and man, I was really glad I knew about the silver, the 500 part per million. You can do that as many times as necessary. I like to put 1 drop of eucalyptus oil in that as well because it just kind of opens everything up and gives it a nicer smell and everything. Ear infections, 500 part per million in Vive mild silver protein, right into the ear, a few drops in each ear, several times per day. Make sure you tilt the ear over, let it stay in there for a few minutes, and then before it kind of comes out of your ear, make sure you have a napkin there. Do both sides 3 or 4 times a day. It's the best thing I know for ear infections. That's, and you can make the 500 part per million with 5,000. You can dilute those strengths. Just make sure you're using distilled water. Okay, so that can easily be done. Anyway, let's go further. So we covered iPlex. We covered the eyes. We've got Ligaplex 1 and Ligaplex 2. I've already talked about my replacement for that. And those are the products that I would use for holding, those were the Cadillac products that Standard Process made for holding your adjustments. The other one that they made was manganese B12. I would replace all of those products with the Disc Discovery because it has a therapeutic dose of manganese in it, and it also has all the other stuff for joint health. Now, if you just said, no, I don't care, I did really good on just the manganese B12, okay, that's fine. I've got the product that I brought in is called M-Enzyme, like MN, like manganese zyme, and it gives you it's a 10 milligram dose, 100 tablets, it's only $13. So if you just wanted to do manganese, I would probably only say you would just need one a day max. You can last you 100 days if you did it every day. And that would be a really good one just to hold your adjustments. Let's say you had no other joint issues, you just couldn't hold your adjustments. Fine. I got that one too. And that would replace manganese B12. But ideally, the Disc Discovery 180 tablets for $29 is more of an upgraded version. And it replaces Ligaplex 1, Ligaplex 2, and manganese B12. And kind of glucosamine synergy. Because it has that tracheal bovine cartilage in there, which is why you take the glucosamine. Okay, let's go further. Linum B6. Linum B6 is much like Cataplex F. It is a whole flaxseed oil. The flaxseed oil that I brought in, I believe, is superior. It's flaxseed oil, cold compressed, organic. 100 soft gels for $20. It's better. Livaplex, I already covered that. The one I've brought in is called Livotrit Plus. 180 tablets. You do 6 per day for a month. That's your 1 month liver detox. Or you could do 2 bottles and do 2 months. But I've already went over that. That's $36. Magnesium lactate. Again, I just feel like the Magnesium 300 by Innate that I've been using for years is just a superior product. It's more from a whole food source, and I've gotten very good feedback from my customers that have got it. And it comes in a powder or capsules, 120 capsules for $30, and the powder 132 grams for $28. Then mammillary PMG. Now this was a hard one because this is a specific product for breast tissue. And typically any breast case, okay, you have somebody that they're trying to breastfeed and they don't have the milk production. You have somebody that has mastitis, inflammation there. Any breast tissue. The product that I have for that is a it's called ML21 Breast Medics. It's a liquid. It's a 30 milliliter liquid. So I have that to replace the mammillary PMG by Standard Process. Manganese B12, we already covered that. And Minchex, we've already covered that. You know, Minchex, you can either do the alfalfa tablets or you could do the innate response, calm response if you wanted to go more of an herbal route. The alfalfa tablets may be all you need, but it just depends. If you have a really bad case of anxiety, you might need to even do both because there is overlap, but there's no overlap in ingredients though. But they accomplish a similar thing. Okay, so moving right along. Then you got Mintran, which is it's kind of like Mintran is more like a child's version of Minchex. And so it would be like, okay, if I had a child come in and they had ADD, HDD, that type of stuff. Typically, I would put them on Mintran. I would say that you probably could get away with doing the calm response and, again, the alfalfa tablets that I had mentioned earlier. That would be a really good combo. With ADD, HDD, you would also want to make sure you get the fish oil in there. And then possibly the GGG product that I told you, that B complex vitamin. It's very similar for my anxiety depression protocol. The ADD, HDD protocols are kind of very, very similar. So that's a good one to think about. Multizyme by Standard Process. This is a enzymatic blend that does not have an acid base. And this would specifically be for someone that had such a thin stomach lining that they could not handle even the good acids, which does come up. There's some people that cannot handle good acids. And so you would prescribe to them Multizyme, and then before I would prescribe Multizyme and Ochrapepsin. Now what I would do is prescribe the innate response, clinical digestive enzymes. They're plant-based enzymes. They're very potent, and they will digest protein, but it's not going to have any kind of stomach or acid-based component to it that would potentially irritate the stomach. Some people will just do better off these. So those are comes in a 90 count bottle, and they're more expensive. They're $50. Typically, when you get into really good plant-based enzymes, you're going to pay more for them, and that's why another reason I lean toward the Hydrozyme, because it's just a better price. But some people can't tolerate those, so you would do. Let's see. You would do, in that particular case, you're going to do these clinical strength digestive enzymes by Innate, and then you're probably going to want to do the herbal GI, which is going to rebuild the lining of the stomach. And then if you had a really bad case, I would add in the pituitary hypothalamus support, because that has a lot to do with acid regulation. Okay, so let's go further. Neurotrophin, which is the specific glandular that Standard Process made for the brain. The crossover product is cytosine B, which stands for brain. It's their glandular for the brain, and I believe it's superior. It's just, I've never seen glandulars as good as the Biotics ones, ever. Next one is Neuroplex, which again is kind of a multi-combo product for the brain. Again, I would say cytosine B, but from Biotics would be the crossover product I would use. Oculotrophin, which is the specific glandular, eye glandular that Standard Process made. I would use the Da Vinci Labs Healthy Eyes that I talked about earlier. Covers more bases. Ochrapepsin, we already talked about that one. It's the herbal GI for $20, 90 capsules. Next product is Orchic PMG. Orchic is basically a bovine testicular extract. And Biotics makes a really good crossover. Again, a superior glandular, cytosine Orchic. They make it for 100 counts. So if you have a male testosterone, you want to increase their testosterone. The protocol that I've got now, ideally to do that, number one, make sure your liver's clean, because hormones are processed in the liver. Two, this product, cytosine Orchic, because it's going to act specifically on the testicles. And then you're going to want to also use the, I want to make sure I say the right thing. It's called Testogain, and it's a product I brought in, and it's a specific herbal blend of different things to increase testosterone, but it doesn't really have the glandular component, and that's why I like to do the Orchic and the Testogain together, because they're very, very complementary. So for men, this is a really good one. You're getting tons of different things, including the Tribulus that I had sold as a discrete product before, but you're getting so many other herbs in there along with it. It's just covering a lot more bases. So that's my protocol I have now for low testosterone. I've done all kind of studies lately where we've talked about that, how they're trying to feminize men. So this is a huge problem. Now, while I'm on the subject, the Simplex M that I sold before was the kind of the glandular one I was using from Standard Process also, and that would be, I would use the Testogain 120 count, which is 53, and then the cytosine Orchic for 18 is my full protocol to replace the Tribulus and the Simplex M that I was using before. Okay, so let's go forward here. Gotta see where I left off here. Okay, I left off at organically bound minerals. Covered this one. I've brought in an organic alfalfa tablet. The essential main component of organically bound minerals by Standard Process was the alfalfa that they use. So I've brought in an organic alfalfa tablet, low heat processed, top of the line, 500 count bottle for $30. I mean, it's way better of a value. It's probably like off the scale if you do a cost comparison on the organic minerals compared to these. Amazing product. So I've got that. I take it personally. And again, it's really good for any kind of anxiety. If you've got tachycardia, racing heart, just kind of helps slow you down, feeds the parasympathetic nervous system naturally. And it also has a lot of other health benefits from just the alfalfa. It's very, very good for you. It's almost like a multivitamin to a certain extent. Next product, Osterplex. Osterplex was the all-in-one multi-product by Standard Process that they didn't promote very much, but it was for any osteoarthritis case. Problem is it only came in a 40-count bottle, and you probably needed to do about 9 a day in order to get a therapeutic effect on any case. So it was kind of, I don't know why they only made it in a 40-count bottle. What I've brought in to, the protocol I've brought in to replace, and this would be for osteoarthritis in general, okay, would be the ENS Flame, the powder that I told you about that has the turmeric, it has the boswellia, it has the CMO, it has all those anti-inflammatory compounds in it for osteoarthritis, and then also, and this would really be for rheumatoid too, osteo or rheumatoid, and then also a liquid ionic boron. Boron is they've done a lot of studies on that, and that by itself can have a tremendous impact on osteoarthritis. Boron. And then also magnesium. Magnesium is really good for any kind of osteoarthritic case as well. It helps with the bone spurs, and it's almost like a natural anti-inflammatory in and of itself. That's why Epsom salt baths work, because it's magnesium, essentially. So those three together for any kind of really substantial osteoarthritis case would be a really, really good combo. Now again, too, you have to understand Rome wasn't built in a day. It does take time for these things to work, but this is a protocol they would probably see very quick results on. But it does take time, especially when you're dealing with bone and bone spurs. And if somebody has huge Heberden's nodules in their hands, meaning their knuckles are all swollen up, and they've got a Dowager's hump in their back, and they've got all kind of that's just not going to probably ever go away. It might reduce some, but the damage has been done. But a lot of times you can achieve a lot of symptomatic relief, though. But a lot of times you're not going to get rid of all the physical deformities that may have taken decades to form. So kind of just bear that in mind. Okay. Next one, Ovex, which was the short, it was the most quick-acting ovary support product that Standard Process made. The replacement product, and again, I think the Biotics products, they're glandulars. Whenever I can do a crossover, I'm going to use them. They're just superior. It's called Cytozyme O, standing for ovary. It's a 60-count bottle for 16. You know, you could add this into any female protocol and pretty much be safe. Any kind of PMS, cramping, heavy cycles, you name it. Any kind of female protocol, you're going to probably get very good results. Adding that one in. Then they also sold a product called Ovatrophin, which was more of a long-term product for ovaries. And again, I would just say Cytozyme O for ovary for that as well. Palmetoplex was the primary product for prostate that Standard Process used. The one I've brought in to replace it, and I try to take one of these a day, and it does help, is Palmetto Plus. And a 90-count bottle for $30. It's a better price, and for what you're getting, I believe it's superior. It has a therapeutic dose of zinc in it, and a lot of prostate products lack that. Zinc is super, super important for any prostate protocol. Okay, whether it's benign prostate, hypertrophy, BPH, or whatever you're dealing with, even elevated PSA, this would be a really good base product to have. So it's called Palmetto Plus, 90 count, $30, and I like the product a lot. I like it better than the Palmetto Plex because I've taken both. Okay, let's see here. Pancreatrophin, which was the dedicated glandular that Standard Process made for blood sugar. I don't think there's any comparison. The Cytozyme Pan that I brought in from Biotics, standing for pancreas, I already talked about it with the blood sugar protocol. You do one of these and one of the Metabolic X with meals on any blood sugar case, and I would be amazed if you didn't see amazing results. And you'll probably see a difference in your energy level, if that's a factor for you. I mean, if you don't have blood sugar issues, no, you're not going to see a big change. But for me, I did, because I've got blood sugar, diabetes runs on both sides of my family. So I'm just more prone to it. And let's go further here. So we're all the way up to parotid, and I'm just about out of time on this one. Parotid, uh, parotid PMG by standard process. I know you do this in mumps cases. You do it for if you feel like you've been ever poisoned at one time. If you feel like, because this is not a product I used a ton of. If you have any kind of salivary issues in your, like where you're the salivation, whether it's you're not salivating enough, you're salivating too much, this would be a good product to do. Okay. And the direct crossover product is cytozyme parotid, which is the Biotics crossover. So that's one there. All right, let's go ahead and stop there, and I will pick up with phosphid in part 4.